The views and opinions expressed on the following program are not necessarily those of the staff and management of Salem Media of Hawaii.
Aloha! Welcome to Be Fit for Health. This is Bianca. I am your host. Thank you so much for joining me today. I know it's your Sunday, and I appreciate you guys hanging out with me for this hour. Like always, we're going to have a great show. I'm so honored and thrilled always to have such brilliant minds come onto the show and to give us a little bit of an education on our body and our health and how we can sustain a balance. And, you know, coming from a background of personal training and health and fitness, you know, I've always had that in my foresight of my mind when it comes, the front of my mind when it comes to how I can look good, but also feel good doing it. And that takes a bit of a skill set and balancing of not only the workouts, but also your nutrition. But there are some things in life that sometimes gets in the way of that. And genetics is a part of that, but also the things that we do and some things that aren't in our control. You know, like maybe getting into an accident or, you know, falling and, you know, injuring parts of your body. As we grow in life in our journey, some things like this could happen. And, you know, then you have structural issues and your body goes through these off balance moments and it can become a chronic situation. So, you know, with me, I used to work out really heavy with a lot of weight. I used to squat almost, you know, 300 pounds, and I'm about, you know, 5'6". At the time I was maybe like 135. Actually I'm that weight now too, which is great. But different body structure. I had more muscle back then. But you know, I was doing a lot, benching about 180. Of course, for my frame, that was dumb because my tendons and ligaments weren't ready for that kind of stress. So of course I had some rotator cuff issues. But you know, not knowing this stuff at young people don't think about these things because we're immortal when we're young. But as we age, it shows up and you have these issues. Well, squatting about 300 something pounds and maybe my form not being perfect, think about your spine and what happens with the compression and the, you know, pressure and stress you put your vertebrae in when you're doing a movement like that with the weight compressing your spine. It's not ideal unless you know what you're doing. And, you know, a lot of people go into the gym, they do these weights and they're squatting, and I'm looking at their form thinking, oh, geez, you know, this guy is going to hurt himself. You know, a lot of ego-based training. But not only that, not only just the workouts, but also if you get into an accident, you know, you might push a disc out of alignment or, you know, things like that. What am I getting to? We all, as we age through time, develop certain issues in our spine. And the reason why I'm talking about the spine is because luckily I'm bringing on a doctor of chiropractic. He's also an athletic coach. You know, an athletic coach is like a cross between a personal trainer and a physical therapist. So this gentleman is fairly well-rounded. When you go to him, not only will you get adjusted properly, but you also get exercises that are done correctly so that you're supporting the muscles that support the spine. And that's really, really, really important. So when it comes to your spine health, we're going to get the download from Dr. Ken. But when it comes to understanding degenerative disc disease, you know, we all have it to a certain level. We started at our 20s, but as you get older, I think from the 20s to 40s is when you actually get a lot of the discomfort and pain. As you get older, it either gets worse or it stabilizes itself. And the body's really smart. It knows what to do. It knows how to, you know, develop extra bones to calcification to support that vertebrae if it's out of alignment. Some people may develop bone spurs, and bone spurs aren't fun. They're like pointy, edgy calcification in the vertebrae, which causes the area to become a little bit more sensitive. So you have inflammation, and that's where you get the pain. So how does a chiropractor work with that? We'll get Dr. Ken to let us know. He's the owner of Trio Health, and he's located here in Hawaii, and he's worked with lots of athletes. He's worked with kids. He's worked with adults. His format and the way that he approaches, you know, your spine health is very unique. And we're really lucky to have him here. I know there's a lot of things that we can do to keep our spine healthy. Obviously, exercise is one of them, and that's something that he condones. He wants you to work out and get the right type of exercise for your spine. Not all of us are the same. We do take medications, obviously, to help our pain, but sometimes there might be another method to help with pain care. And so we'll talk with the doctor on that as well. But as I was doing a little bit of research on it, some of the causes that can cause a degenerative disc disease could be, as again, aging. You could be dehydrated. Your disc can get dehydrated. The only way that you can get hydration into the disc is through movement, and that's really, really important. Sometimes we tear things up, and then we push, a little bit more by working out more and moving more, and we may cause more of a damage, and that's where the herniated disc and bulging disc occur. But, when it comes to the symptoms, we all know pain is a big symptom. You feel pain, you go to the doctor, you figure, what do we do? But, having a good support team, not only having a good orthopedic doctor, but having a good chiropractor is imperative. So, I'm not going to talk about chiropractic because that's not my specialty. I understand exercise, but between me and Dr. Ken, we'll be able to give you guys some good education. So, we're going to take a quick break. And when we come back, we're going to be with Dr. Ken, and we're going to talk about chiropractic health.
The Honolulu Club is still here for you. We are providing the safest workout conditions on the island, with modified safe distancing indoor and outdoor classes, large open work floor with clean, sanitized machines and free weights. Let the Honolulu Club be your one and only fitness destination. Go to honoluluclub.com and fill out the trial pass today.
Have you heard of microcurrent therapy? If you suffer from chronic pain, arthritis, sports injuries, ligament injuries, or migraines, the electroequiscope can help. This non-invasive treatment system is drug-free and shows no negative side effects. If you are seeking pain relief and want to boost your immune system, schedule a demonstration or consultation by calling Kelly, your microcurrent electrotoxologist, at 485-9697 or follow on Instagram at Kelly's Time. Make your appointment today.
All right, we're back. You guys ready for some good, fun education on our spinal health? Well, we're lucky to have Dr. Ken Fuyuki, and he is a doctor of chiropractic and athletic trainer, like I said before. His facility is here in Hawaii. It's called Trio Health, and I am excited to have him on. Dr. Ken, are you on?
Yes, I am. Hi, Bianca.
Hi, thank you so much for joining me today. I'm really excited because, the audience kind of knows that I have my health issues and, things that are going on with me. So I always bring and I share, and I'm open book. I share with people what's going on with me. But to have someone like you on to talk about our spine and, adjusting and what happens to our back and how does it feel and how do we start the road or journey to a better spinal health. You being the specialist, I'm excited to have you on here. So thank you and welcome.
Yeah, thanks for having me.
Of course. So, I know you have a really great background. You're not just a chiropractor, you're also an athletic trainer, which is a little different than personal training. Can you give us a little bit of a quick breakdown on what athletic trainers actually do?
Sure. So athletic trainers are, if you think about like an EMT for sports, with the in the background, on the field, that's what you see, like an EMT type of work on the field. And then in the background, in the clinic, what you see is more of like a physical therapist aid type of treatments that's going on. And so that's kind of like the mix of the EMT and the physical therapy aid inside a sports realm. Nowadays, it's more into the regular workforce, like tech companies like to hire athletic trainers for ergonomics and just prevention care and all that kind of stuff. Yeah.
Well, that's exciting. So when someone is to having your background, so I know you have your own facility. So if I was to walk in there and I have we were talking about degenerative disc disease, how would Trio take care of me versus me just going to a basic chiropractic adjustment?
Sure. So a lot of chiropractors in Hawaii I'm sure many whoever has experienced a short amount of treatment time. So it's about like a 5 to 10 minute treatment. Maybe you see 2 to 5 minutes max with the doctor themselves, and then there's an aide that will render other treatments for you. A trio is about a minimum of 20 to 30 minutes treatment, so it's much longer. And I think from that athletic training and that chiropractic perspective, the quality of the treatment has to be there. And when the quality of treatment is there, then you can reduce the amount of time you have to get into the office. Mm-hmm. Therefore, you getting back to doing what you love more faster.
Got it. So how would you put me through some kind of a period of physical movement first before you adjust me, or would you put heat on me? Is there a type of like temperature regulation as well, or?
Sure. So we would do an initial exam, and the initial exam consists of different things like family history. A lot of history is where you get a lot of information with what's going on. So that's the most important part. And then we'll move into range of motion, palpation, kind of move you around, maybe even do a squat assessment to see how your whole body is functioning from the ankles all the way to your neck, because everything is related to each other. There's this kinetic chain that moves, right? So we look at functional movement, and then we'll determine where needs to be adjusted, where the restoration needs to occur within the joint. And then we'll also do manual therapy. So at our clinic, we don't really do a lot of the stim or electric stim, ultrasound, heat, all these other modalities. We do a lot of manual therapy. Manual therapy is a lot with our hands. And that's exactly what chiropractic means, right? Healing with the hands. So that's what we try to focus on.
So you're doing basically a little bit of different modalities prior to just the adjustment. So it's, from my experience, the really good chiropractors that I've had experience in LA and some here are the ones who actually are doing like active release, or they're doing some kind of heat therapy, or they're doing some kind of TENS unit, something just to get the muscle awake, or maybe the spine brain connection thing. Maybe they're trying to get the brain activated, knowing that this is what is needed. Is because there's a lot of times I'm finding that central nervous system that's in the spine gets miscommunicated. There's a disconnect somewhere, and you guys are trying to get that connection back.
That is part of what we do. I wouldn't say that's entirely what we do, at least from my perspective and my philosophy and how I approach problems. I focus a lot on musculoskeletal conditions, which is anything related with muscle, nerves, or joints. And so that's my primary focus. The secondary would be the central nervous system. And I explain that because according to research and the heavily backed up research nowadays, the chiropractor back then and the chiropractor right now, where we're heading, is really moving forward with the research, and it's pushing forward on the musculoskeletal conditions. So that's where I primarily focus, and that's where I see the best results.
Right, because the muscles move the bones don't move the muscles. So you got to get the muscles on the same page. Even the nerves that control the muscles, right? So that's where the central nervous system and the communication from the brain to the muscle really matters too. Right. So how difficult is it to treat somebody with, let's say, stenosis or some form of degeneration in their spine, especially if you're adjusting? Because mostly it's in the neck and in the lumbar area. How long does it usually take to? I know it varies from people to people, but generally speaking, how difficult and how long does it usually take to help somebody get back into some kind of balance?
It really depends on how acute or chronic these conditions are. Degenerative, let's talk about a little bit about degeneration. Right. So degeneration, you can't really reverse, right? The only thing you can do is to prevent it from occurring fast. So in that sense, it's a lot of prevention and strengthening the muscles around the joint to help take off the load from the joint itself. Because the muscles around any joint, whether it be the knee or the spine, is made to be strengthened to absorb any force. And that is able to take much more force than the joint itself. So if the joint is taking the beating, that's where the degeneration is going to happen, because the friction and the misalignment that might be there is going to cause a lot of the issues. And so by adjusting and restoring that joint, and then also doing corrective rehab to strengthen the muscles around that joint, is going to help offload that pressure on that joint. So that's how you minimize the degeneration. But you can't necessarily reverse a degeneration that's already occurred.
And I was told you can't rehydrate the disc if it's dried out, correct?
Yes, but yeah, it's similar to the whole point of the degeneration. You can't reverse the dehydration, but you can minimize the after effects, I guess you could say. So spines like movement. Any joint really likes movement, right? And that pumping effect, whether you're walking or going upstairs or lifting weights, it really doesn't matter. As long as that spine is moving, it's pumping.
Right.
And that pumping action is called imbibition. And that imbibition is going to push out the waste and bring in the nutrients from the fluid. And that's what's going to help reabsorb the fluid back into the joint to lubricate that joint. And not only that, but to bring in the healthy nutrition to allow healing to happen.
Right, because if you're sitting and you're laying for too long, you're stagnant. There's no blood flow there. There's no nutrients getting there. So that's why they say even if it's very mild stretching and you're moving, that will bring that nutrients back into that area so that you're able to be mobile at least. And that's why it's funny, because when you wake up in the morning, first thing, you're very stiff, right? And then you move a little bit and all of a sudden that pain and everything else kind of dulls out.
Yeah, exactly.
That's what's happening. But when it comes to the, bone stenosis, that's extra calcification. That's just to help that's the body's way of defense mechanism of trying to support the vertebrae, correct?
Absolutely. Yeah. That's a natural effect that's going to happen. Absolutely.
But that bone spurs are what causes a lot of the inflammation, though, does it not?
Yes. And so stenosis is basically the closing of a hole, whether it be the central canal or the holes on the side where the spinal nerves come out. So that's something that you have to differentiate and make sure you can figure out which one it is, whether it be from exams or X-rays or MRIs or what have you. But yes, the bone spurs can likely hit a nerve or cause inflammation, and that could be a lot of people's issues on causing that pain or the increase in the tingling or the numbness that you might feel.
So would chiropractic help that?
Stenosis?
Yeah.
Stenosis itself is very difficult. In any spinal condition, you want to try conservative care first, and that's where chiropractors come in, and even physical therapists or massage or any alternative medicine. That's where you want to go first, and you want to do a trial of care. If you don't see a progress in whether your function or your pain, then you want to get referred out because that person is not able to help you. So you want to try something else, even within the alternative medicine, or you might go to get a shot, injection, to help with the pain relief. And then there's a step of, if that doesn't work and we're all working together to try and help that patient. And if we're not able to, we have to, it's morally correct to refer out and help that patient, because it's all about that patient, right? It's all patient-centered. And if that's not working, then we'll go into surgery as the last case scenario. And central canal stenosis is very hard with the results with any modality or care that you might receive. However, you always want to kind of start with the alternative or conservative first, and then go into the injections and then the surgery. So I don't know if I answered that question right.
No, that's it. And there's obviously what you're saying is there's options that people can take. The injections you're talking about is like steroids, maybe? Is that what you're talking about? Or is it cortisone, or what's the?
Yeah.
Okay.
You could start off with cortisone shots, and then there's nerve blockers if it's touching a nerve. So it just really depends on what the condition and the symptoms are,
right?
And what's causing it. Or it might have to be surgery to take off that bone spur that's causing a lot of the or touching the nerve or causing the inflammation. So it just really depends. I know that's not the best answer, but can chiropractors help with central canal stenosis? Yes, but it's a yellow flag for us. And so we will modify our treatment. We won't be putting or trying to put any or force any type of treatment on you. We have to really play with how your body reacts and what positions you like and what positions you don't like. And so it's really patient-centered. It's not really cookbook, as you could say. So even the timeline of how long it could take is so up in the air. Depends with what you do, your genetics, your treatment, your lifestyle, your diet. Everything comes into play at that point.
Got it. You see, again, guys, nutrition.
Nutrition.
I keep talking about that. But people don't understand food is medicine. I mean, if you eat the right types of food, because I'm understanding also with degenerative disc disease and certain things that are happening in our spine, it could be the lack of calcium. It could be the lack of certain vitamins, that your body needs to produce a strong, healthy bone, or muscles to support that area. But it is nutrition, and it's and if you're eating junk food and you're eating a lot of sugar, I mean you're basically depleting the system, which is gonna help. If you have a genetic disposition, it's just gonna speed that up even more.
Yes, absolutely.
So with your clinic, do you guys do anything else? I mean, as far as, is it like a gym? Do you have like a gym equipment area? Do you have like a area for the rehab, or do you guys have an area for the soft tissue manipulation? What's it like? What's the experience like to come into Trio Health?
Sure. So right now I'm renting out a room from a bigger clinic. And so my area itself is just the treatment room with a table. That's where we will do the exam, the soft tissue, whether it be like the active release or soft tissue therapy, with the manipulation. And after that, we always try to incorporate some sort of rehab, corrective exercise, because, everything works together. Everything is complex and everything works together. So we try to do corrective exercise. There's a small rehab area in the front. And so that's where we would teach the patients exercises to do at home, so that they can they have a little bit of homework to do, because you only see me maybe once or twice a week for 20 to 30 minutes, but outside of that, there's so much time that things need to be maintained for you to process this healing, or to go through this healing process. So.
Yeah, and it takes a while. Do you guys do or require X-rays, or do you guys do any of that stuff, or is it just physical exams?
So we do not require X-rays. According to research, everything I try to go back with research. So it's about 11 to 12% that need actual X-ray, and so for me, it doesn't really make sense to have that X-ray in my building or in my practice. There is a radiologist and an X-ray and MRI facility downstairs, so that's where we refer out to if it's needed. But it's all on a needed basis. We don't X-ray everybody. If it's necessary and there's red flags or if there's concerns, then absolutely we'll do that for the patient.
So let's talk a little bit about then spine health. So let's say structurally the spine basically keeps us straight, yeah? The muscles supported the erector-spinae group, and your abdominal muscles also help with supporting the spine. How important is our spine? How important is our spine? Yeah, explain what our spine is in relevance to our body.
Sure. It's really our foundation to our skeleton. It protects the spinal cord, and without your spinal cord, you can't do anything. Literally, you can't just have the brain. The brain itself won't do anything. The brain has to have a spinal cord, which is, think of it like H1, right? The freeway H1 on Hawaii. And the spinal nerves that come out of it is as like canal exit or pro-city exit or whatever you can think of, right? The exits. And that barrier is what protects, and the lanes is what protects this H1 to function properly. And similar to that, our spine and our spinal cord is the highway to how we function, whether that be gut health, whether that be our brain or moving. I focus more on the moving side, how our muscles are controlled, how the nerves are controlling that muscle, where that muscle attaches to that bone or joint. So that's where I focus within the spine. But the spine is so important just because it helps us to stay upright, to help us to bend down, pick up our kids, or to play a sport that we like, or to be able to travel and sit. And anything that you do literally has to do with the spine. So that's very important.
Yeah. So the way that I looked at it too is that the brain is the CEO and the central nervous system is like the upper management. And then you've got these nerves or like your, workers that go out there and tell the other workers the information that came up from the upper ups. And, so, like I always tell people too, like if you have like a sciatic issue, a lot of times one of the symptoms could be stomach issues. Like you might feel nauseous or you might feel a little stomach issues because the gastrointestinal nerve is right next to the sciatic. And so people don't understand that when you're massaging someone in their back, because I used to be a clinical massage therapist. And so when I massage the sacrum area and the lower back area, sometimes I would get a patient saying, "Oh, I feel a little nauseous," which kind of tells me that something was touching each other, like, or some kind of relationship was interacting with each other when it came to the sciatic and the gastrointestinal nerve. So there would be some stretches that would need to happen that would maybe help alleviate one or the other. One got inflamed or what have you. But the spine holds not just the nerves to the muscles, but it also holds the nerves to the organs, does it not? There's also communication there.
Absolutely.
So,
when you look at the autonomic nervous system, absolutely.
So whenever I get allergies, I was talking to a great pulmonary doctor, Dr. Fuyuki. I was telling him, there in my neck, there is nerves that affect my nose. So when I start sneezing and I'm starting to get some, ear stuff or nose stuff, I palpate my neck area and it usually alleviates the pinching feeling that I get in my nose and I stop sneezing.
Yeah, there has been cases where, you get adjusted in the upper cervical and you feel a release in your nasal passage and it's almost like it's emptied out and you feel a lot of the relief from the congestion. That has definitely occurred in the past for sure.
So that's really interesting. I mean, you guys aren't just adjusting the spine. You guys are now, when you adjust the spine and you're reinforcing it through your physical exercises and stretches, you're now helping also the body to function in the, like I said, the autonomic and also the skeletal muscular. So it's really a big deal. And I don't think people understand what you guys do. And this is why I'm bringing you on, because I'm trying to reestablish the connection with chiropractic, because there is a place for chiropractic business. You guys are not just there to adjust my bones. You guys are doing something.
Yeah, everything is connected, and it's really complex, our body. And honestly, no one knows exactly what's happening anywhere, right? We're trying to still figure out the pieces and back it up with research and do case studies and all that kind of stuff and see what's actually happening. So it's really important to, obviously, when you get adjusted and something happens, that's an experience and a quality of evidence for something that has occurred. And so that's really valuable to share and to really look more into, because it's so hard because the body is so complex, right? And everything is intertwined and connected. And when we look at even just regular medical research, internal medicine or whatever it may be, it's so complex, right? And there's so many unknowns, but we're still piecing the puzzle together, as I say to a lot of my patients. So it's really interesting how all that is so connected and it works.
Yeah, it's very fascinating. And that you guys, you and I talked briefly the other day regarding the immune system. It doesn't directly make your immune system like it doesn't help your immune system better, like a vitamin C or what have you, or things like that. But it does aid in helping the body do what it needs to do to help build your immune system. by correcting your alignment, you're allowing the body to communicate properly, correct?
You know, this one is a very unknown area from my trying to find the research on it, and like there has been a lot with the COVID and all that timing right now. There has been a lot of talks about this. You know, if you get adjusted, you're going to boost your immune system, and there has personally. Side note, I think this is more of a marketing play because when you look back into the research, there is really minimal evidence of that, and so I can't really say
right one or the other
wholeheartedly that there's a cause and effect of when you get adjusted, then your immune system goes up. Like, can it be related because everything is complex and connected? Absolutely, and I'm 100% behind that. But just because I don't see too many evidence behind it, I can't promote it myself. But can it be affected, and has people that have been adjusted get their immune system up? Probably. So really, it's hard to say for me personally.
Right.
As a chiropractor myself, like this equals this. I can't say that, but is it possible? Absolutely.
Yeah, because I think in the terms of internal stress, oxidative stress, or any other type of inflammation stress. So when the way my logical brain may not be logical, but I think it's logical. My logical brain thinks that when you take down a stressor, and cortisol is not the first person in charge anymore, then you're allowing the body system to focus on immune. And it's not focusing on fight or flight, it's focusing on building the immune system. So I think the correlation has to do with internal stress, alleviating that, allowing the natural balance, and then letting the body do what it's naturally can do.
Yeah, because that goes back to the parasympathetic versus sympathetic nervous system, and a lot of us are stressed, right? And that stress causes that cortisol to be released,
right?
And then that causes the muscles and the joints to get tight and lack mobility. And can there be effect from that? Absolutely. And when you're in that parasympathetic rest and digest, you're calm, you're relaxed. That's where the body heals the most, right? And that's where the immunity happens the most. So absolutely. Could there be a relation to that? Absolutely. Yeah. I agree with that.
So, as someone who hasn't maybe seen a chiropractor, but is trying to, do the right thing by balancing their system out, are there any type of suggestions you can make to, obviously you want them to come see you, but is there any suggestions out there that you would give them as far as stretching exercises to do so that they're not so tight?
Yeah, absolutely. So the most common reasons why people come to a chiropractor is low back pain or neck pain. It has to be related to the spine. So, neck pain and low back pain, very common in this day and age, especially because we work on computers, we sit a lot. And so that in itself, if you have a laptop, that's probably the most convenient tool, but the worst thing that you can probably do to your neck, right? Just because ergonomically speaking, it's not in a functional position. Now, can you get tools and stands to help you, external keyboards and all that? Absolutely. But for the stretches, so have you heard of the pigeon stretch?
Yes, but you might have to kind of explain it.
Okay, sure. How do I explain this? You sit down, you cross let's say we're going to work on the right leg.
Okay.
You're going to cross your right leg over your left knee.
Okay.
Almost like a figure four.
Got it.
And then you're going to bring your ankle into your thigh into your hip as high as you can. And then your knee will pop up most likely because we're tight on that right side. So we're going to grab our right knee and then with both hands, grab our right knee, kind of interlock your fingers around your knee. And then you're going to pull it towards your chest.
You should see our producer. She's trying to do it.
Is she?
Yeah, it's funny.
Is it working?
I don't know. She looks confused.
Oh, okay.
But no. But you know what?
I'm not doing good.
No, but they can look it up too. I mean, you can look it up. It's called the pigeon stretch. Yeah. So they can YouTube it if they needed to. But
there's a lot of stretches for your lower back. That's a very common one, especially because we sit a lot.
Yeah.
So this muscle naturally gets tight. And this can also cause pseudosciatica, which is like pseudo as in like fake sciatica. It's not actual sciatica. It's basically that piriformis muscle. This is a piriformis stretch.
Right.
So that piriformis is smashing that sciatic nerve and then causing that tingling numbness sensation.
And that's a
but it's
common
not
issue.
actually, yeah, it's very common. I see that almost at least twice a week, or treat twice a week for that. So it's really common. And this stretch itself can also just alleviate that pseudosciatica. And so it works really well. And any hip area is going to affect your lower back, right? So we want to work on the hip area, not only for our knees, the joint below, but for the joint above, which would be our lumbar back. So,
and how often would you want your patients to do these stretches? Like twice a day, once a day, before they sleep, when they get up? How's your regimen usually?
I recommend twice a day. When you wake up in the morning to allow your body to move, and right before you sleep. But it really depends, because when I say that, no one really does it, right?
No,
so,
of course.
I try to make it, So I try to make it a little bit more convenient, like start off with once a week, and then, you've done well for the past 3 weeks. Okay, let's try and put in another one, so twice a week.
Right.
So you got to modify to what the patient can handle and what the patient's willing to do, really, because you can say that the literature says 2 times a week or 2 times a day is best for you, but you say that, but no one's going to do it, so it really doesn't matter.
Right.
You kind of got to adjust and modify.
It's really hard. Not everyone's motivated to do the work. They rather come see you, get the adjustment, have you do a soft tissue, something or other, and then go to their day and get their work going. But I think you're right. I think for me, every night I do some kind of stretching before I sleep, because I figure I'm going to be stuck in bed for about 7 hours. Without moving. And I have degenerative disc disease. I also have scoliosis, which I'd like to talk about. But I have the bone spurs. I have all that stuff. So when I get up in the morning, the last thing I want to do is to tweak something and not be able to move for the rest of the day, So, do you recommend any type of, therapeutic ointments that you would, have used on your clients, or? Pain or
off the top of my head, no. Over the counter stuff I recommend. It just really depends on like the ointments. There's so many out there, so I just say try it. Make sure you do your research first.
Yeah, because you don't want to put some chemical stuff in your skin that gets absorbed.
Yeah,
might not be good.
Yeah, and so there's not one that I like particularly use or anything like that. It's just really more around the preference of the patients and what they hear and what they're interested in. And, if there's something that they want me to look up, I'll definitely look up and, dig in and see what the literature says. But do I recommend something for that kind of stuff? No, I don't.
Okay. Because I know that some people don't like taking medication. Some people won't take medication. Like I don't do Advil or, ibuprofen, even though it's an anti-inflammatory, just because of the other effects that it comes with the liver.
Yeah,
but
absolutely.
I do use, and I'm talking because I have fibromyalgia as well on top of everything else. I do use occasionally, not all the time, unless I'm really severe, Salonpas patches, or I'll use Phyton stickers, those titanium stickers, which are it's really funny because it looks like a Band-Aid. But, when I was working at a supplement company and they were selling it there, I had a military guy come in and he's like, "What is that, a Band-Aid?" I said, "Tell me where you hurt." And he goes, "It's right here." And I stuck it on him. Literally within a couple of seconds, he gets up and looks at me and goes, "What is that?" It's interesting how it works. But, but again, something may work for you, may not work for another person. So like you said, do your homework, do your research. That kind of stuff helps.
And
go ahead.
Oh, no, I was going to say, like anti-inflammatory stuff, you're just talking about nutrition. There's a lot of foods have anti-inflammatory effects, right? So as long as you incorporate that into your diet, then you'll be okay,
Correct.
It might not be that immediate quick fix, but long-term wise, it's going to help you.
Well,
So,
turmeric is great. Ginger is great, right? You can add
Yeah,
those as,
yeah.
part of they're supplementary too. You can take them as, pills
Yeah.
if you don't want to
Yeah.
put them in your food, but those are great
put in a
stuff.
smoothie, blend it up.
Exactly.
Very easy to
Yeah,
take,
absolutely. So I would say for the most part, keeping your nutrition, having a good balanced exercise program as far as movement goes, because what you're doing with stretching is like more like dynamic stretching, right? They're more like almost like exercise with stretching movements, almost like a yoga like fashion to some degree.
For me,
Yeah. Do you have that kind of regimen? Is it more dynamic or is it more yoga like? What's the
it's both.
okay.
Yeah. So the dynamic side would be more outside of my clinic. I'll show them and then
Yeah.
they'll do it at home.
Perfect.
But a lot of even just that whole pigeon stretch can be static. Hold it for 30 seconds to a minute. And we do a lot of PNF stretching.
Uh-huh.
And so that helps a lot to actually activate the muscle first and then to release it. So we do a lot of that kind of stuff.
Yeah. I find that when you wake up in the morning, I think more of the dynamic is much more better than static just because you haven't moved for a while. I wouldn't want you to pull something.
To get the blood.
Yeah.
To get the blood flowing first. Absolutely. Yeah.
So, really quick, going into another topic because we're going to be running. This is how my show goes. We get into a great conversation and then time starts running out and I'm like, no.
Yeah.
So I know a lot of people have either mild to medium level scoliosis. How do we treat that?
So there's two different types of scoliosis, and it's functional or structural. So first, the structural side is idiopathic, and both are idiopathic. Or sorry, that's not true. The structural side is idiopathic, and so we don't really know how it happened. It's probably genetics, and the severity of that really depends on how much degrees it is. So in that case, you would want to get an X-ray to figure out what phase you're in.
Right.
And depending on that phase, we treat it differently. So it could be, if it's not crazy, it's less than 20 degrees, then it could be chiropractic care, it could be a brace, and then physical therapy. And then from 20 to 40, we have to start putting a brace on. If it's greater than 40, we recommend an orthopedist to see if you need surgery, because at that point there could be other higher risks to that. And so that's the structural side. Now to the functional side. The functional side is like when you tweak the back, your back, lower back, and then now you're walking a little weird.
Yeah.
But now, and it hasn't gone away, and now your spine's a little bit crooked.
Right.
And that's causing other issues like neck pain or ankle pain or whatever it may be.
Right.
So it's a functional thing. So something actually caused it. And so those are the ones that I like to focus on with the conservative less than 20 degree side on the structural side. So the functional side, we can definitely help, and you will definitely see results in that spine to actually straighten out. The structural side, however, is our goal isn't to necessarily straighten it out. It's more about function. And are you able to move and do the things that you're able to do? Are you able to bend down? Are you be able to play sports or whatever it may be, and your goals and your values, right? So we take all of that into account. If that kind of makes sense.
Yeah, it does. Because I'm thinking, like with the one that you like to attack as far as working with, you could teach the body to let go of the tight areas and then try to strengthen the weak areas to maybe straighten it out to some degree so that you're a little bit more standing up, not so crooked. Because the hip, because eventually it's like a domino effect, is it not? Because when the hip gets hiked up on one side and then it's twisted anteriorly, and then you're trying to walk straight, but you're not really walking straight. You may not even be using your glute muscles anymore because that may have turned off.
Absolutely.
So now your back's taking a lot of burden, and that can actually trickle all the way up to your neck. Something is so small. But so, the exercises are really crucial. And this is where, as me being more of a functional personal trainer, it's like you really need to know what muscle is tight and work on that side of stretching it, and then what muscles are weak. And usually the weakened muscles are the ones that are being stretched out by the tight muscles, right?
Sorry, one more time.
It's like usually sometimes the weak muscles are the ones that's being stretched or pulled to the other side by the tight muscle. So you may have to strengthen.
It's almost like reciprocal inhibition.
Yeah. And and I know our audience is probably going, "Oh, what language are they speaking?" But it's just terminologies that we're using when it comes to understanding what muscle shuts off so that the other muscle gets activated or inhibited type of thing. So you're able to move forward or backward.
Absolutely, yeah. So everything is connected, right? And a lot of people have muscular imbalances, and so when we don't address it early on, it's going to become a chronic thing, and that's going to cause another secondary problem. And that secondary problem can obviously come into a third problem, and it's just a domino effect, like you said. And everything is connected from your hip to your left shoulder, or your ankle to your neck. Everything is so connected that when someone comes in for like upper neck pain, I obviously address everything, and sometimes I just adjust the left ankle and the upper back releases. And the reason behind that is just the kinetic chain and how it works and how there's patterns to your body. And it's a lot about like biophysics or biomechanical manipulation, and how that can affect somewhere else. So it's really interesting and fascinating. That's part of the reason why I love what I do. It's like a lot of problem solving, right? So, yeah.
Putting the pieces together that, you have, first you spend a good amount of time talking about what they've been doing, how they're doing it, how they're moving their stuff, and, what happened to them when they were 5 years old, what happened to them when they were seriously. I mean, how many car accidents have you gone into or what have you? I was just telling the audience when I started, not knowing my genetic situation, I was benching almost 180 pounds and then squatting about 300 pounds. And my frame is small, but I'm stupid strong. And genetically, that's how my brother's like that too. He's really strong, but we have very small bone structure. So when you do that kind of stress and load, you start to stimulate the negative response in your body, which is, not going to help you in the long term. So I feel like, with some of the things you're talking about, it's like our body is just, broken down so much so that, to rehab it to balance it out, it's going to take a long time and a history of understanding what your body went through to get that person back to alignment.
Yeah, your history is very, very important to understand the whole picture, because, one injury here doesn't actually talk about the whole thing. So it's just a small puzzle, right? So the more you can understand the whole person, their lifestyle, their family history, their past histories, their past surgeries, maybe that all paints a picture in what's going on. So yeah, absolutely.
So I always tell people, if you're walking crooked, stop doing what you've been doing, because you're probably enforcing that form and that posture more so. You need to seek professional help, either physical therapist, chiropractor, personal trainer, clinical, not just a regular massage therapist, but maybe a medical massage therapist that understands the, muscles that work together type of thing.
Yeah. I kind of want to encourage, your body is adaptable and it's going to respond to the stress that you put on it. Right. Yeah. And that's why there's that functional, issues that might come about. But at the same time, I want to encourage you that could be seen as a negative, but the positive to that is because it's adaptable, you can fix it, right? And so you can create new stresses or proper stresses, positive stresses on your body to help you be able to adapt more and make your body to become stronger and make your body to be able to move better, right? And that in turn will reduce your pain and increase your function.
Right. And that's kind of important. And you just got to know how to do that. And so, you could do your research, you could YouTube it, you could do all that stuff. But at the same time, though, if you don't have form, the proper positioning of your body before executing a stretch or a movement, you may not be supporting the right groups of muscles the way that you want to, and supporting the spine as well. So that needs to be taught. Sometimes I always tell my clients when I train them, this is your education time. You need to learn, doing a lat pull down. People do it wrong all the time. Squats, people do it wrong all the time. and you may not be a good candidate for some of them, depending on what's going on. You teach that in your practice, I believe.
Yeah. It's very like corrective exercise based. So we're not doing like heavy things. We're using bands and going back to the foundation and of the technique, I guess you could say, and what muscles to actually think about when you contract or use that muscle. So it's very, very, we try to keep it as simple as possible.
Well, you have to. I think initially most people don't know how to start. So it's kind of, and then when you have someone like me who has worked out most of her life, and then you get me back down to the basics, it's so hard.
Yeah, it can definitely be hard.
It's like, I want to lift those weights, but I can't. You want me to do what? Bands? Come on, man.
Yeah.
No, it's kind of hard.
That's the frustrating part about PT too, right? Like, I love physical therapy, and my mentors are physical therapists, so we always talk about things that could be related and how we can help each other. But the PT side is like all these basic movements, and people get tired of it or can get frustrated with it because the results don't come as fast, and everything takes time, and the patients know that. But it can be frustrating because you're doing minimal movements,
right?
And you don't see the results as fast as you expect, right? It's all about expectation too.
Right.
So to be able to manage that, and like you said, there's so much information out there on Google, on YouTube, that it can be overwhelming, and you just don't know where to start. So that might be a good indication to seek professional help and guidance, right?
Right.
Yeah, absolutely.
It's funny because I always tell people that, it takes a certain time frame for us to develop a pattern. So you've been doing a certain pattern for a very long time, and your brain automatically goes to that pattern. To reteach your system to have a new pattern, you need to invest in at least minimum 21 days to 3 months to get your brain and your body back into a new pattern where your body can now use that as their normal. So it's going to take a lot of patience on people's part when it comes to getting their body rehabbed or getting their spine to stay. Because I know I've had adjustments that stuck, and I've had adjustments that would not stay. And that could be based on the pattern of muscles that would do certain things, and I wasn't maybe correctly exercising it the way that you'd probably want me to.
Yeah, absolutely. Habit, right? So whether it be like the physical side of like making sure our rehab is correct or technique, but even the mental side, because that can have the effect on that muscle. Like we just talked about the sympathetic, the stress. If you're constantly stressed, no matter what we do, that muscle is going to start to stay tight, right? So,
yes.
Your rehab can be going out for a walk for sunset, enjoying the fresh air. Like that is just as important as doing a lat pull down correctly to activate the right muscles.
Right.
I think.
Yeah. No, you're smart. And, I just want to say that we ran out of time, but I want to get people to have access to you, Dr. Ken. So I know your company is called Trio Health. So your website is triohealth.com or .co?
No, it's .co, not .com.
Okay.
Without the N.
Okay. So CO, not COM. So triohealth.co. And then you do have social media, do you not?
Yes, I do.
Okay, so your Instagram is triohealth.hawaii?
Correct, yeah.
Okay, and then your Facebook is it's Go Trio Health. Go Trio Health.
For some reason I couldn't use the same username as
I know, that's
it's
the
so
part.
weird.
I know. Well, and your name isn't that kind of where it's common, so it's not like you should have been able to have gotten it, but who knows? Yeah. But
it's okay though.
Yeah, I know exactly. What's a good phone number they can reach you at?
They can reach me at 808-542-0504.
Okay. And then your email is drken@triohealth.co?
Correct.
Dr. Ken at triohealth.co. Awesome. Well, I appreciate you coming on and giving us your info. I love the fact that you're so technical. I appreciate everything that you shared with us today. Thank you, Dr. Ken. And that's at Trio Health, guys. Go see him. Check him out. I want to say thank you so much. Thank you. Thank you so much, everybody, for joining me today. I wish you all the best. Stay healthy, stay safe, and aloha.
It's a different world right now. How we live, work, and learn has changed. We're home more, online more. And at Post University,